and protect your trachea and prevent anything from being able to get into it when you're swallowing or eating. But sometimes it does occur. We also talked about epiglottitis, and we talked about the reason that a lot of children, if they do get epiglottitis, it's because that they haven't had their Hib vaccine, right? And the symptoms are drooling. And one of the reasons that a drooling occurs is because there's pain and there's swelling. And then there's also a real bad high-pitched sound on breathing while they're still able to breathe. And that's the airway getting tighter and more swollen, and preventing less and less air from being able to go in. And that's a picture of it, and you can see that very narrow portion of the airway and the swollen epiglottis itself. The next thing we're going to talk about is the larynx. The larynx is called the voice box. Like your granny, she would have said, oh, the voice box. But our larynx is actually it's a muscular and it's cartilage and muscle that's made up together. It's lined with mucus, and it basically is the connection at the end of the pharynx. All right, and what it does is it allows for a couple of things. The larynx has a C-shaped ring called the cricoid cartilage around it at this point, and it's there as a protective mechanism. And that protective mechanism is there to protect the Adam's apple. That's also where our thyroid sets. So men's are usually a little more predominant than a woman's due to testosterone. And this is that C-shaped cricoid cartilage that I was talking about, right? And that's that protective, because it gives it just a layer in case some kind of traumatic event or something did happen that to the throat area. This would hopefully prevent crushing of the airway and allow for a little more stability. The trachea is the next structure that we're going to move to. So now we are to the airway portion. And then, okay, I was saying the trachea was commonly referred to as the windpipe, right? And that windpipe was the old-fashioned term before they had more medical terminology. It's about 1 inch wide, and it's about 4.5 inches long. And it extends from the end of the larynx to the chest, and where it bifurcates, splits off to a left and a right stem bronchus. And that's what you see here. So we can see our larynx, and we see the cricoid cartilage, and then the trachea. And then you see the trachea has these little rings around it. These are also muscular rings that provide protection and cartilage to give it an extra amount of strength and ability for protection. Okay, the trachea itself, its job is to move air. It's to bring O2 in, and it's to deliver and remove excess gases like CO2 and other gaseous debris. Okay. Next, I always tell everybody that I feel like our chest and our lungs when you look at it, it looks like a tree. And I've always thought that. I always thought that the bronchus from the trachea, we move on, and here's the trachea, and here's where it splits, all right, to the patient's right, patient's left, and you can see how it splits into multiple sections. And there's thousands of these little sections, and these are all different divisions, and we call these bronchi. All right. Now, like I said, from the bronchus, we go to the bronchi, which is a bit smaller, and they're like the branches of the tree. And some of them are a little larger, where some of them go and actually reach down to very small, microscopic sizes. Okay, but they're all branches in this tree. Now, bronchioles are the very last. And I'm going to go actually to this picture. So, real quick. So, imagine we were right here, okay? And now we're looking and zooming in, and this is what we're looking at. So, from the bronchi, we move to the bronchiole. And the bronchiole is the last bifurcation or last bit of the tree limb, okay? It leads to what we call our ovuli. And our ovuli, I like to think of them as the leaves or the budding flowers, because in a baby, like a newborn, we know that their lungs, even though their tree has formed, at gestation, some of them, all of their little flowers haven't opened, and all of those ovular sacs still haven't budded open. And that's why sometimes babies have difficulty breathing, they'll have respiratory distress, and it's just because it's not anything that's wrong necessarily with the baby, it's just this is one of the last things that occur. This is why with preemies they do need that additional respiratory assistance and so forth. The ovuli are vital, because when we look at the ovuli, we notice that they are a bunch of tiny little sacs, right? And that's here. And then they make up one large unit of ovular sacs, right? They have a duct, and that duct is what connects them to the bronchiole. And when you think of the ovuli, I want you to think of them as they're each microscopic, but each one of them are vital. They're little bitty balloons, and in a healthy person, they inflate and deflate as air moves in and out. And this is where oxygenation exchange occurs, is at this level right here. Okay, and I'm going to go back a slide. They are, when we're talking about the ovuli, there are more than 6 million ovuli in our lungs. So that's like, wow, that's a lot of ovuli, right? And then this is one of my favorite pictures, because here we see the bronchiole, and we're going to the ovular duct, and we can see the ovuli. But what a lot of people don't realize is there's always blood flow, even if it's at a microscopic level. So we have blood coming in and blood going out. And so the blood that's coming into the ovuli is blood that's coming from the heart, and it's deoxygenated. And that, the whole purpose of the cardiac respiratory cycle is to send that deoxygenated blood into the lungs via these capillaries, and then oxygen, like this picture right here, the bad already used um, blood cells are removed, the CO2 and the other debris. And then the alveoli, which is nice and full of good oxygenated lung from our last breath, replaces all the empty spot now and takes the hemoglobin, and now we have an oxygenated blood cell that's returning back to the heart. And from there, we know from the heart, where does it go? It goes everywhere. It goes through all the body. And so if we have 600 million of these, so this is occurring on a massive scale. And you think, okay, so I'm good. I've got this covered. But like we can see with a lot of respiratory issues, that even when a small fraction of the lung is injured or damaged or ill, that it greatly affects this CO2 out, this O2 in, that cycle. And that's where a lot of our respiratory diseases come from. And we'll talk about that. So far, is there any questions before I move on about going back here, the trachea and how it bifurcates to bronchus, patient's right, patient's left, okay? And then it separates even further to the tiny branches of the bronchi. And then from there, it goes to an even smaller branch, the bronchioles, where it ends up in the tiny, like little balloons of the alveoli. And that's where the magic happens. That's where the gas exchange occurs. Is there any questions?
Now, if you were to open up our body, could you see like the branches and stuff like that? I know it might be a stupid question, but I just
No,
wanted to
it's
ask
not.
anyway.
It's not a stupid. You can see them to an extent, and I'll share with you a picture. You can. There's actually wonderful pictures, and if you ever get a chance, if you're not squeamish, there's an exhibit called the living body or the human, and it's basically people have donated their bodies to science, and they've made them into works of art. And basically you can see muscle, and you can see lung, and you can see skin, and you can see the heart, and it actually travels. Somebody's got to mute the mic. It actually travels all around the. I'm gonna need whoever joined to mute the mic.
I don't like it. Bro, I can't even get any sweaters.
Sorry. Okay, and y'all can see my screen again, right? But yeah, you would be able
Yeah.
to see a certain portion of the bronchi. All right. But then it gets to like a microscopic type of level, and it's usually not, but I'll show you the pictures. You'll see what I'm talking about. I don't want to stop the presentation right now, but I'll share with you because it's really cool.
Okay.
Pulmonary surfactant in everything we have to have some sort of lubrication to prevent friction. And surfactant is what we have that are in the lungs and the alveoli and all around. And this is one of the things that's not present in premature babies. And so that's another thing that's an issue when a baby's born preterm. Pulmonary surfactant can also become decreased as we age. It can become decreased with or inflamed or infected or uh, things can happen to decrease it. And when that happens, it can severely uh, impact the way that we breathe and how we're able to breathe. And it can actually cause pain during breathing. Okay, so the surfactant is like the lubricant that the lungs need to breathe and to do that without pain, without discomfort, to make their job easy. And here's an example of a preemie's lungs. You know how I was talking about that their trees are developed, but not all of their flowers and branches, the little buds have budded fully. Now, we know that a baby we have amazing capabilities nowadays that a baby at gestation 24 to, I've seen 21 weeks where they're this big and survive because of the technology that we have nowadays. But this is where we see gestation all the way up into 3 years old are all of these little flowers or buds opening and fully forming. So we still have lung development even as we're growing as a baby. Okay. The lungs themselves are a pair of spongy, air-filled organs, right? And they're about 10 to 12 inches. And the right lung is a little bit larger than the left lung because the left lung has to make room for the heart. Okay? The top of our lung is called the apex, and the bottom of our lung is called the base. And our lung actually has protective linings, and we call this the visceral. This is the one right up against the lung. And then we have parietal, and that's the one that covers the lung. All right. And we call this pleura. And that's why if you've ever heard of somebody say, oh, I've got pleurisy, that means that they have got some type of inflammation in between those linings. And that can make breathing very painful. It can make breaths feel like, sharp, kind of grating, irritating pain. And that's because either it gets filled with infectious fluid or it lacks surfactant or something like that. So there's different reasons for pleurisy. The word ventilation, if you don't know this, you should write this down. The word ventilation means to breathe. Now, usually, when we use it in the medical sense, when we have to ventilate a patient, that we're thinking of more of the fact we're having to breathe for them. So, like we know that a lot of our COVID patients are placed on ventilators, and I shared with y'all. Might not have. Did I share with you the video of how ventilators work? I think I did, but maybe not. But if let me know, and if not, I will. Because even though you won't perform an intubation or place somebody on a ventilator as a medical assistant, that might be something that you could witness. And an intubation is when they place a tube in the mouth, down the throat to the trachea. And that tube is then inflated and connected either to a bag valve mask, and that somebody, every time they breathe, they squeeze and breathe for the patient, or it's connected to a machine that we call a ventilator, and it breathes for the patient. Okay. But when we think of our process of our lungs, the process of breathing is ventilation. When we inhale, that means we're taking air in. When we exhale, that means we're moving our air out. Okay? You should understand both of those terms. Inhalation, breathing air in, exhalation, breathing air out. Okay? Our diaphragm is, I like to think of it, it's the parachute. Our diaphragm is a dome shaped muscle. It separates the lungs and the abdominal cavity. And I like to think of it as our little muscular elevator because as we breathe, it aids and assists us. And without the diaphragm and the intercostal muscles around our rib cage and so forth, we would not be able to ventilate properly. And this is what sometimes happens. People who have spinal cord injuries will become paralyzed, and it prevents signals from going from their spinal cord to the diaphragm, telling it rise and fall, rise and fall. So they're having to be placed on a ventilator. So if this is not connected and sending the proper signals, you won't breathe properly. So the diaphragm plays a very important part with our ventilation process. And this little picture is just showing you another expression. Inhalation is known as inspiration, bringing airflow in, and then exhalation is bringing the airflow out. Okay? And then that's what both of these are saying. Now, these are some terms that I would like make sure that you write down. Each one of these need to be written down because each one of these are terms as a medical assistant you should be familiar with. Dyspnea is the first one, and it just means difficulty breathing because we know dys means difficult or pain, right? So difficulty breathing, dyspnea, apnea, and this is without, right? So it means without the breathing for 19 seconds or longer, right? So we see this with people who have sleep apnea, where they can go, 19, 20, 30 seconds without getting a breath. And these people need devices like a CPAP to help them be able to sleep at night. Orthopnea, ortho is, we're thinking of our positioning and standing, right? So orthopnea means that this patient is taking on a specific position to help them and aid them in their breathing. A very common thing with a lot of respiratory disorders is I've had patients with chronic CHF, and if you try to lay them back, they automatically feel like they're drowning. They have to have an upright position. That would be orthopnea. Some people during asthma attacks or panic attacks, they'll place their hands on their legs like the gentleman in the picture. This is called tripoding, and it's part of orthopnea. It basically means taking a position to aid you into breathing better. Hypoxia is the lack of oxygen in the body. This means that there is not enough O2, okay? And now certain areas can become hypoxic, okay? Like say if you have a blockage in a blood vessel in the brain, and that from the blockage there past the area past it is going to become hypoxic. And if it's not restored, a death of the tissue and death of the cells and can start to begin to occur. Our body cannot go. Same thing with the heart. If you have a massive heart attack and you have plaque blocking part of the artery and oxygen can't travel to it, that area is going to become hypoxic and eventually ischemic and lead to cardiac cell death, right? So this is bad. Asphyxia is suffocation. And this is usually where a patient is unable to breathe. They're either their suffocation is due to something internal like excess fluid, or it could be something external like somebody's trying to suffocate them, something like that. There's different situations for each of it, but please make sure you write down and know these terms. We're going to stop here, disorders of the lungs, and we'll pick this up tomorrow. And can somebody let me know, did I share the intubation and ventilation video with y'all?
I don't recall seeing it.
Okay, then I'll post that. And then I'll also, real quick, I can show you the, trying to find a really good one. I don't see a cross section. That's what I want to see, cross section, S-E-C-T-I-O-N. Let's see. Well, I'm not finding what I want, so I'll let y'all go for now. If I find the picture, I'll post what I was wanting to show you, how you can see the bronchioles and everything. But if you haven't done your SurveyMonkey, please make sure that you do that. And then the other thing that I was going to tell y'all is it is imperative that if you are an on-campus student, you do not go to the campus until it is your scheduled time. Do not go early and don't show up late. They have it set up so that there's not too many people on that campus at once because they have to maintain social distancing. And please remember that I posted a list of what you're supposed to be covering this mod. So if an instructor asks you, what skills do you need to work on? You'll have that right there in your WhatsApp. Take a picture of it and say, okay, we're in 1020, so this is what we're doing. Okay. And now if you finished those skills and there's an instructor who wants to continue and move further, I'm completely okay with that. And I know Spring does that. She's excellent. So please make sure you're following your guidelines: uniform, stethoscope, lab coat, blood pressure kits, mask, hair pulled back, the whole 9 yards, and acting professional and making sure that you maintain your mask, social distancing at all times, okay? And I'll see y'all tomorrow. Thank you, guys. Make sure you hang up.